Good afternoon everyone. Today, I will perform EINC or Essential Intrapartum Newborn Care. By the way, my name is Leanne Grace de Belen, a BSN 2 Sotejo. So, let's start. Preparing for delivery. First, we need to check the temperature in the area. It should be 25 to 28 degrees Celsius, eliminated air draft. The air conditioner is turned off at time of delivery. Next, ask woman if she comfortable in the semi-upright position of delivery table. This helps the mother to achieve her greatest comfort during delivery. Good afternoon, ma'am. My name is Leanne Grace de Belen. Are you comfortable with the semi-upright position? So next is, we need to ensure the woman's privacy. So next, we need to remove all jewelry, then wash the hand, truly observing the WHO 1, 2, 3, 4, 5 procedure. This prevent the transfer of microorganisms. Next, we need to prepare a clean newborn resuscitation area or a firm and flat surface. Check the equipment if clean, functional, and within easy reach. This is to ensure safe progress of delivery. Next, we need to arrange the materials in a linear sequence. Gloves, dry linen, bonnet. Next is the oxytocin injection, the plastic clump, scissors, and 2 kidney basin is in this area. In a separate sequence, after the second breastfeed, eye ointment, stethoscope, vitamin K, hepatitis B, and BCG vaccines and cotton balls are in this area. So next, we need to clean the perineum with antiseptic solution. It will help to reduce transfer of microorganisms. Ma'am, I will clean your perineum area. Next is wash hands and put on 2 pairs of sterile gloves aseptically. delivery, we need to encourage the woman or the mother to push harder as desired. It helps the mother to push down the best she can. You need to push harder as you can. In the count of 3, you need to push. 1, 2, 3, push. One more time. 1, 2, 3, push. 1, 2, 3, push. So the next step is we need to draft a clean, dry linen over the mother's abdomen or arms in preparation for drying the baby. Next, we need to apply perineum support and did control delivery of the head. To safety handle the newborn when it comes out of the birth and the perineum. Birth canal and the perineum. So the next step is we need to call out time and birth, time of birth and sex of the baby. 1:45 p.m. Female. Next is we need to inform the mother of the outcome. In the first 30 seconds, truly dry the baby for at least 30 seconds, starting from the face, going down to the trunk and extremities. The next step is this is to stimulate the baby to breathe and to prevent hypothermia. In the 1 to 3 minutes, remove the wet cloth to prevent the baby from getting cold. Next is place the baby skin to skin contact on the mother's abdomen or chest. It helps to achieve success in breastfeeding. Next is cover the baby with the dry cloth and the baby head with the bonnet. Next is this procedure provide warmth and comfort to the baby. Next is excluded second baby by palpating the abdomen in preparation for giving oxytocin to determine if there is a second baby, and if there is one, do not give oxytocin and perform the delivery. The next step is give 1 m oxytocin with 1 minute of baby's birth after wiping the soiled gloves with the wet cloth. Dispose the wet cloth properly. Next is remove the first set of gloves after positioning the baby for the cord clamping. This contaminated the gloves properly in 0.5% chlorine solution for at least 10 minutes. This is done to disinfect the soiled gloves. Next is palpated the umbilical cord to check for palpation. Next is after palpation, after palpation stop, clamp the cord using the plastic clamp or cord tie from the base. Next is place the instrument clamp place the instrument clamp 5 centimeter from the base. Next is we need to cut near the plastic clamp. So the next step is we need to perform the remaining step of the AIMTS. Waited to the strong urine construction. There applied controlled cord traction and counter traction or the uterus, continuing until the placenta was delivered. Massage the uterus until it was firm to promote uterine contraction. Next step is inspected the lower vagina or perineum for the laceration as necessary. This helps to determine if repairs are needed. So the next step is examine the placenta for completeness and abnormalities. So the next step is we need to clean the mother and apply perineal pad or napkin. It will help to remove the debris such as blood, waste, and secretion. Next is we need to check the baby's color and breathing. And check the mother if the mother was comfortable. So the next step is we need to dispose the placenta in a leak-proof container or plastic bag to prevent infection. Next is decontaminated the instrument in 0 to 5 chlorine solution before cleaning and decontaminated second pair of the gloves before disposal for at least 10 minutes. Next step is we need to advise the mother to maintain skin-to-skin contact. This will help to achieve success breastfeeding. Mrs. I will advise you to continue or maintain the skin-to-skin contact with the baby. Next, in the 15 to 30 minutes, advise the mother to observe for feeding cues. It means that the baby is ready to breastfeed. I will advise you to always observe if the baby is ready to breastfeed. Next is we need to supported the mother, instructed her on positioning and attachment. Next is we need to waiting for full breastfeed to be completed, because after the administration of the vaccine is accomplished. Next is after breastfeed, administered eye ointment, the vitamin K, hepatitis B, and BCG injection. Eye ointment is given for the prevention of eye infection. Next is vitamin K. Vitamin K helps the blood to clot and prevent serious bleeding. So, ma'am, I will administer vitamin K for your baby. So next is the hepatitis B and BCG injection. So, ma'am, I will administer hepatitis B for your baby. Next is the BCG injection. So, ma'am, I will administer the BCG injection. So after that, advise optional or delayed bathing of the baby because washing um, is usually done after 6 hours. Next is we need to advise breastfeeding per demand because breastfeeding allows the baby um, to be satisfied with his or her hunger. So, mom, I will advise you to breastfeed your baby if she wanted to. So the next step is in the first hour, check baby breathing and color, and check mother's vital signs and massage the uterus in every 15 minutes to determine if the baby is cyanotic or not, and to determine if the mother and to determine the mother status. Next is in the second hour. Check the mother baby's diet every 30 minutes to ensure safety and effective care. So in the last procedure, we need to complete all records. It will serve as the baseline and future reference. So that is all. Thank you.